Hello everyone, welcome to Heartypedia channel. Today we are going to go over 9 warning signs of health symptoms that you should never ignore. Make sure to watch until the last warning sign because it's one of the most common warning signs I've ever known. Make sure to subscribe to the channel so we can share with you the top health tips regularly. Now, let's get straight into the video. Sometimes when you have an ache, soreness, or dizziness, it is just an occasional pain. But if you are having any of the unusual symptoms constantly, it can be fatal for your health. And you need to get it treated before it gets serious. So in this video, we will discuss the 9 warning signs of health symptoms that you should never ignore. This video covers vital information that will help everyone in their daily life. Watch the video till the end so you don't miss any important detail. So, let's start. Number 1. Frequent fatigue. Sometimes a person is tired after work or some other activity. But if you are feeling tired all the time, you need to start taking it seriously. Frequent fatigue can lead to many harmful diseases. Many symptoms reveal you have frequent fatigue like hallucinations, poor concentration, irritability, muscle weakness, headaches, stress, depression, and many more. Fatigue can be caused by many factors. The major one is your unhealthy lifestyle. If you are not having enough sleep or you do not exercise, or excess alcohol can cause frequent fatigue. There could be some medical causes like diabetes, heart disease, or thyroid disorder, etc. Unhealthy food consumption can also lead to frequent fatigue. To get rid of this condition, you need to first find out what is the real reason behind it. If the frequent fatigue is affecting the quality of your daily life, like being unable to sleep, work, or exercise, then you should consult a health specialist. He will have a detailed discussion with you with many relevant questions and provide you a plan to follow. In other cases, your doctor can give you a prescription to follow. Whatever the case is, if you have frequent fatigue, you need to have an appointment with your doctor right away. Number 2. Brittle pale skin. Are people asking you if you look too pale lately, or do you feel like your color is pale? Then you should not take it lightly. Paleness can occur on different spots of your body, or your overall body can be pale. Have you witnessed your skin completely pale after you got scared for some reason? That is because your body focuses the blood into vital organs in such cases. Pale skin happens because of the lack of oxygen in the skin. Many causes can lead to brittle pale skin. Anemia is a medical condition in which your body does not make enough red blood cells, resulting in pale skin. Anemia occurs because of a lack of iron in your diet, or it can be genetics as well. There are other natural causes like shock, lack of exposure to sunlight, frostbite, or blockage in some of the blood vessels. Constant brittle pale skin means you can try to get rid of it by eliminating the causes, so it can be treated without getting serious. In case of an emergency like vomiting, fainting, or pain, you need to meet with your doctor right away and let him handle this situation. Number 3. Trouble with vision. Are you having trouble seeing things clearly or having a distorted vision? It can be a serious problem. Vision issues are usually related to advancing age, yet monthly eye checkups can expose issues that might have been difficult to even notice, but those are non-fatal. Blurred or distorted vision and young age can be because of other issues. Vision issues are usually because of medical conditions like cataracts, optic neuritis, stroke, scarring, corneal abrasions, migraine, and of course, older age. If you have diabetes, you can also experience eventual troubles with your vision. If you want to prevent developing any of the above, you should adopt some practices like wearing sunglasses in sunlight, stop smoking if you do, undergo regular checkups, and eat eye-rich nutrients in your diet. If you are having trouble with your vision, then go to your doctor and have a thorough examination. The test can include asking questions about eyesight and blood tests as well. Take the prescription your doctor provides you and follow it properly to avoid your eyesight from getting any worse. Number 4. Irregular heartbeat. Do you feel like you have skipped a heartbeat or maybe added one? That means irregular heartbeat and is called arrhythmia in medical terms. In most cases, irregular heartbeat is harmless, but if it occurs more often, then you need to stop taking it lightly. The disturbed rhythm of your heartbeat occurs because your heart is unable to pump sufficient oxygenated blood to the body. Sometimes an irregular heartbeat is so silent you cannot even notice it, so you need to have regular checkups to tackle such situations. Other more prominent symptoms of irregular heartbeat are pounding in your chest, pain in the chest, weakness, sweating, dizziness, fainting, or even blurry vision. The usual causes of irregular heartbeat are heart disease, reduced blood flow, post-surgery effects, stress, and excessive consumption of tobacco. Some other reasons could be the disturbed balance of electrolytes in your blood, or wrong electrical signals in your heart. Prevention is the best cure, so the first thing is always to prevent yourself from developing any of these symptoms by avoiding everything that leads to them. Secondly, if you think you have those symptoms or irregular heartbeat, then consult your doctors today and let them do their work. Number 5. Frequent shortness of breath. Shortness of breath refers to being unable to breathe properly. If you often have difficulty breathing or hunger for air, this means you should start to worry about getting treatment as soon as possible. If you have an allergy, inflammation, or some metabolic condition, shortness of breath can be the symptoms. Let's find out what are the causes of shortness of breath, how to find out you have issues, and the remedy for it. Sometimes shortness of breath can happen after some intense exercise and is harmless as well. Shortness of breath in pregnancy is also a purely natural phenomenon and nothing to worry about. But there could be some serious issues that cause a shortness of breath. The condition of inflammation in the lungs due to oversmoking can cause shortness of breath, and it can be difficult to treat. The severe shortness of breath can also be caused by asthma, some heart conditions, and even lung cancer. And in these cases, shortness of breath can be life-threatening. So, if you are experiencing frequent shortness of breath and do not know why, you need to have a proper checkup and detailed session with your doctor to find out the true cause of the shortness of breath. Start getting treatment and prevent it from getting any worse. Number 6. Swollen or stiff joints. As we age, we start to feel pain, discomfort, and stiffness in our different body joints. If you think you are still young and have swollen and stiff joints, then you know you have some issue going on. As the name suggests, your joints are getting stiff and you are unable to move them without having a painful experience. Many underlying causes can be the culprit for swollen and stiff joints. Let's have a look at those causes. Inflammation is the most common known cause of stiff joints, which makes walking very painful, and it usually occurs in older people. Other causes for swollen or stiff joints can be degenerative joint disease, lupus, bone cancer, and gout, etc. You should see the positive side and consider stiff joints as symptoms of the more dangerous underlying problems and need to be treated ASAP. In case you have swollen joints that are not recovering and last for more than 5 days, it is finally time to go to your doctor, find out the cause for it, and get both of the issues treated. The general recommendations to treat the swollen joints are through daily exercise, oil fish supplements, cold compresses, or even some regular pills like aspirin or ibuprofen, which can help with the pain a lot. Number 7. Persistent cough. Cough comes with flu or fever, but even if you recover from it, the cough does not go away. But why? Research reveals that it could be a recovering phenomenon. Coughing helps in washing your lungs out from the irritants, but the coughing is supposed to last for just a week. If you still suffered from a persistent cough, then it could be a fatal condition. Persistent coughing can be the symptom of various diseases and needs to be taken seriously. If you have persistent coughing, it could mean you still have infection or inflammation in your lungs. Some hidden conditions like allergies, asthma, medication after effects, or acid reflux, though these conditions are not life-threatening. Is smoking the reason why you are coughing up a lot? It can be cancer. Coughing blood and spiking fever could mean pneumonia, and these conditions can put anyone in real danger if not taken seriously. For allergies or controlled asthma, it can be controlled with prevention and the right food style. But have an appointment with your doctor in case of severe persistent cough and let him know your case. Follow the doctor's prescriptions and give yourself a chance to recover, or at least finding out as early as possible cancer is the reason behind it. Number 8. Frequent headaches. Frequent headaches, referred to as daily headaches as the name suggests. It is still unclear to doctors what causes daily frequent headaches. It could be because of tightening of head muscles, activation of the trigeminal nerve, or genetics, but most of the time, it does not cause any serious harm. If you are going through the painful experience of frequent headaches of more than 15 days a month, then it is most probably not a common headache. It is possibly caused by harmful conditions. Some common causes for frequent headaches are inflammations in the blood vessels somewhere close to the brain injury, tumor in the brain, or head infections. If a person has a history of headaches, he could have developed chronic migraine causing one side of the head to pain and is serious enough to put his life in danger, or chronic tension migraine, which hurts all sides of your head equally. Hemicrania continua can be another fatal condition that might be causing severe headaches. If you are suffering more than 2 times every week, you need a higher dose of normal pain pills, or your pain pattern worsens over time. this is the time to go check with your doctor. You may also need proper medical care if the pain is extreme and sudden, causing fever or vomiting, or does not stop even after medication. Subscribe and turn on notifications so you don't miss more videos of health tips and much more, and I'll see you in the next video. Take care.